My name is Alina. I played for the Brooklyn College women's basketball team, and yesterday during my game against Baruch, I sprained my left ankle.
So Alina, my patient, she came to see me. Yesterday she twisted her ankle playing basketball at a game. She said she was making a layup, and as she was making that layup, after the land, she walked a little bit more to jump to see if she got it in, and as she was about to run, her foot got stuck and she fell and twisted her ankle. And I think she probably sprained her ankle. You could tell from the swelling, and I did a few special tests and she tested positive. So if you'd like, we do have a pain management doctor. You can see her if you don't want to get an MRI right away. It could be this week or next week. She could take a look, do an ultrasound of the foot, and she could see if you potentially have any tears in any of the ligaments, and she could refer you out for an MRI, which you don't have to do, but at least she'll have it. So if you're not getting better and it's still bothering you.
Okay. So she massaged my ankle, and then she gave me some exercises to do, and then I went to go get a sonogram to make sure all my ligaments are intact and there's no fractures, and then I got a script for an x-ray.
Alina, great news. She can see you at 3:30.
Oh, she's in there?
Yeah, but in an hour. So at 3:30 she'll see you.
Okay.
Perfect.
My examination suggested she sprained the ATFL ligament, which is on the outer part of the ankle. That ligament is the most commonly injured ligament, although sometimes people have medial ankle sprains or high ankle sprains. We really need MRI to fully check if somebody has this type of injury, but examination and ultrasound is helpful at pinpointing or guiding treatment until an MRI can be done. For my part, it's mainly the diagnostics that I do. Sometimes I can do injections for people, but that's usually more in the chronic pain section of things, and older patients. I really try not to touch the high school athletes if I can avoid it.
During the session, I did a few special tests just to see what was going on. From what I gathered, it seems to be a potential lateral ankle sprain, but she also had pain on the bone itself. We kept the session really light because the injury did happen not even 24 hours ago. Did gentle table exercises, and we ended with cryo to help with the swelling. After she saw Dr. Marcus, I did some cryo to help reduce some of the swelling, and yeah, she said she felt a little bit better. I told her what to do at home, keep icing it, do some mobility exercises to keep that range of motion, and yeah, she'll be coming twice a week.
So I came here because I want to get back on the court as soon as possible, and I know that they'll get me right here and I'll be back on the floor. So right now I'm a little frustrated, but I know by keeping consistent with my PT, that I'll be able to return to play as soon as possible.